All right, welcome everyone to the UNM Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Cassie Brown, Research Assistant Professor in the Division of Forensic Behavioral Sciences here at UNM. For our talk today, please ask questions in the Q&A, not in the chat box, anytime you feel comfortable, but just know we will not get to them until the end. Also, we always try our best to get to as many of your questions as possible, so please forgive us if we run out of time and cannot get to yours. If you're pursuing continuing medical education credits, the sign-in sheet will be in the chat shortly. In the last 5 minutes, the link will be posted for APA continuing education credits. You have to save your certificate after you complete the survey because we don't keep copies on our end. If you missed our most recent talk in the series, Dr. Courtney Simmons' discussion of the role of adverse environments and antisocial behavior and psychopathy in youth is now available on our YouTube channel. And the link for that channel will also be posted in the chat box. The recording for this week's talk should also be available on our YouTube channel later this week. And the PowerPoint slides will be accessible for people registered for the series later this week as well. As a heads up for next week's talk in the series, we have Dr. James Fairfax Colombo discussing the sequential intercept model as a public health model. But let's get back to this week. I'd like to introduce you to today's speaker, who will be discussing data-driven prevention of gun violence in K-12 schools. This is Dr. Jillian Peterson. Dr. Jillian Peterson is a criminology and criminal justice professor at Hamline University and director of their forensic psychology program. Dr. Peterson launched her career as a special investigator in New York City, researching the psychosocial life histories of men facing the death penalty. She earned her PhD in psychology and social behavior from the University of California, Irvine, and went on to lead large-scale research studies on mental illness and crime, mass shootings and school shootings, which have received global media attention. Dr. Peterson is a sought-after national trainer and speaker on issues related to mental illness and violence, trauma, forensic psychology, and mass violence. She is trained in restorative practices, violence mediation, crisis intervention, de-escalation, and suicide prevention. Dr. Peterson, on behalf of UNM, we're excited to have you join our series and thankful for you to be sharing your expertise with us today. I'm now going to turn it over to you.
Thank you so much. Thanks for having me. Happy to be here and looking forward to your questions, certainly. Let's see. I think you know all of this information. I do want to mention the disclosures, that I do not have any relevant financial relationships or commercial interests to disclose. And all of the views presented are my views, and do not necessarily represent the views, policies, or positions of the University of New Mexico. And I'm just going to jump over these learning objectives and jump right into it. So I'm going to be talking about primarily K-12 school gun violence today, what we know about it and what we know about prevention. I am the executive director of the Violence Prevention Project Research Center, which is focused on using research and data to reduce violence with a real lens on sort of action-oriented research, and also very kind of centered in the humanness of the problem of violence. So all of our work, we build a lot of data sets, we do a lot of statistical analysis. We also make sure we're always talking to those who are directly impacted and having their voice influence our work. So we are probably best known for this mass shooter database, which we started building in 2017 with a group of just volunteer students it was right after the Las Vegas shooting, who were frustrated with how little we actually knew about this problem, with the fact that nothing was getting done. My interest was in the relationship between mental illness and mass shootings. And I think at the time I started Googling what percentage of mass shooters had a mental illness, and I realized we didn't know. So this was just an Excel spreadsheet. Any person who killed 4 or more people in a public space, we put in the sheet going back to 1966. which is the year of the Texas bell tower shooting, which is oftentimes associated as kind of the first public mass shooting because it was filmed. It was streamed on television at the time. So it's about 200 perpetrators in the database right now. They're coded on 200 pieces of life history information. And this is a publicly available database. You can download it, you can look at it. So lots of variables related to early childhood, related to mental health. We have a whole gun database, which is how every gun was obtained. We do use a very narrow definition of a mass shooting. I could go into definitions of mass shootings forever. We use 4 or more people killed in a public space, not associated with domestic violence or family, and not related to another felony. So something like a drug deal or a robbery gone bad or retaliation, gang violence. The reason being, we were really interested in studying this very specific phenomenon of people coming into a public space, firing indiscriminately at people they didn't know. And so that's why we did that narrow definition. It's not necessarily that we're counting mass shootings, but we did a deep dive into the psychosocial life histories. And with that work, we also wrote to any living perpetrator of a mass shooting that we could identify who is incarcerated. Most of them die during the mass shooting, which I'll get into. But the ones that live, there was about 32 of them that we could identify. 7 of them wrote back and were willing to do life history interviews with us. So this project was funded by the National Institute of Justice. So in addition to building the database, also talked to 7 perpetrators and then tried to talk to people who knew them. Early elementary school teachers, their moms, their siblings, anybody who could give us an insight into who this person was before they did this horrific thing and what their pathway to violence was. And we published that in a book, which if you're interested more deeply in this work, you can get most places. Really focused on those interviews with the perpetrators and the people who knew them. And I'll talk about some of the content today. And since then, we have also built a lot of new databases. So these also, if you're a data person or you're interested, these are all publicly available. Every homicide at a K-12 school since the year 2000, every homicide at an institute of higher education, every homicide at a house of worship, U.S. presidential assassination attempts. We are working on a workplace insider threat database. Our goal with all of this is really to just add data to our conversations, particularly around public policy. When we talk about mental illness and mass shootings, when we talk about, what's happening at colleges and universities, let's actually ground our conversations in data and take some of the fear, some of the politicalization out of it. We also provide these just free to researchers, to policymakers, to advocates. I would encourage you to play with them if you're a research person. Please use them, publish your findings. The goal is just to create data. It's kind of shockingly how little data is truly out there in terms of trying to track these trends over time. So I will first chat about the K-12 school homicide database. So this is every homicide with any weapon committed on K-12 school grounds at any time of day. So this is actually widely inclusive. It includes things that happen, in the playground in the middle of the night. It includes things that happen in the hallways, any type of violence, domestic, disputes are all in here. So there's 274 incidents starting in the year 2000 through 2023. We're adding 2024 data currently. And as you can see, the trends are kind of undeniable. We've been having more and more incidents of gun violence in K-12 schools, and specifically of gun homicides in K-12 schools. They've been steadily increasing. We saw the sharpest jump really in 2018, 2019. You see the dip during the pandemic when the schools are closed. There still were homicides mostly on playgrounds and parking lots and things. And then they spike back up 2021, 2022, 2023. About a quarter of those perpetrators are students. And then another sort of 6% are former students. We talk a lot about mass shootings and school shootings, which I will talk about, but actually the most common situation that's happening in K-12 schools is an escalation of a dispute. And this tends to be something that, in the 80s, maybe it would have been a fist fight, but so many students are armed, either with knives or with guns. So many students are bringing guns to school because they feel unsafe, that disputes are escalating into homicides really quickly at rates we haven't seen before. If you look at location, so a lot of this is that kind of community violence, moving into school grounds, kind of bleeding into school spaces. So you see a lot of parking lot, outside on property. In the actual school, it's mostly hallways and inside the building. There's been a remarkable increase in homicides occurring at sporting events, like Friday night football tends to be one where you will see violent incidents. We've seen a lot more of that in the last couple of years. And you can see most of these are not active shooter incidents. So these are not what we talk about when we talk about mass shootings. Most of these are those sort of fights or retaliation or escalation. About a quarter of them took place during class. Most common times were morning classes and then also sporting events in evening and night. This is school mass shootings. So compared to the 274 incidents of homicide, I think we're up to, I don't know, 15, 16 of these. So this is 4 more children killed in a K-12 school, person coming in, firing indiscriminately at people that they don't know. And these are the ones, like, you say the name and we can all picture the incident. So these are the ones that tend to get the big headlines and tend to sort of push conversations forward when it comes to research and policy. Fear of school shootings is pervasive in this country. I have 3 children in elementary school. I very much feel this way. Every time there is a shooting, it's just incredibly anxiety provoking to have to send your children back to school. We know from surveys that this is something that students are actively thinking about, that parents are thinking about, teachers are thinking about. People are buying bulletproof backpacks. People are spending truly billions of dollars on school security and bulletproof doors. This is something that is top of mind for a lot of people. So while there is, relatively few school mass shootings compared to other homicides happening on schools, these ones are so terrifying and their impact is truly massive. This is a recent study we did. This was a national survey. It was 10,000 people that were surveyed with the company YouGov. So they pull a nationally representative sample. Incredibly, 7% of Americans reported being on the scene of a mass shooting in their lifetime, which was mind-blowing. At first, we didn't necessarily believe it, but then we realized, for mass shootings like the Vegas shooting, there's 30, 40, 50,000 people on the scene of that shooting. So 7% of Americans said that they've been on the scene of a mass shooting. And if you look at those mental health impacts, so we have one chart for mental health impacts of a mass shooting, one chart for mental health impacts of gun violence. People are having incredibly high rates of mental health impacts, anxiety, depression, panic attacks, post-traumatic stress disorder. What I was amazed by is the amount of symptoms that continued for up to a year later. This was actually especially true for community gun violence exposure, really long-term mental health impacts. So this is not something, that's just hitting the person or two when we hear about in the news who survived the shooting or who was narrowly missed. These are people where these are happening in their communities, they're on the scene, and they're really, truly having long-term mental health impacts. So what do we know? I'm going to be talking about what we know, and this is particularly for school mass shooters, what we know about their life histories. And so this is based on coding out those 200 variables and also conducting interviews with some of those school mass shooters. We know that they're insiders. Particularly at K-12 schools, 85% current students. If you include former students, you're more like 92%. This means that the most common perpetrator of a school shooting is a child who goes to that school, right? And so that one finding, I think made me reframe how we think about school security, right? We spend so much time and energy on things like cameras and doors and systems. The perpetrator is moving in and out of those systems every day, right? They know exactly how everything works. They know where the school resource officer stands. They have been running through, school lockdown drills since they were in preschool. They know the exact protocols and procedures. From that perspective, prevention's harder. But the nice thing about an insider threat is that prevention in other ways is easier because these are kids we see every day, right? These are kids in their classrooms, on the sports teams. These are kids that teachers and administrators and parents are interacting with. So it does make prevention in some ways more possible. Perpetrators are overwhelmingly male. So of school mass shooters, all male except for one transgender student. We did just have the first in a while kind of high profile female school shooter. She's not in our database because 4 more people didn't die, but it is her profile is actually really similar in terms of her pathway to violence, but that is quite different. So that'll be interesting, I guess, to see how that trend holds. What we do know in terms of why boys, I mean, you could have a whole seminar on why boys commit more violence in general. And I think, there's a million reasons for that, from biology to sociology. What we find is school mass shooters really tend to see themselves in previous shooters. They tend to really identify with the shooters that came before them, to study their lives, to read their manifestos, and to feel kind of part of this group. That I think is one reason why you tend to see a similar type of profile over and over again. Racially, school mass shooters tend to be white, so white shooters are overrepresented. When you look at mass shooters as a whole, it's actually not as white, I think, as the media or something would think, but for school mass shooters, it's 81%. This is the pathway to violence that we uncovered. And this played out differently in each perpetrator's life, but you see this same thing. It's sort of over and over and over again. This is particularly true for school mass shooters, but all mass shooters. So first, early childhood trauma. And this is really significant trauma, sexual abuse, physical abuse, neglect. We ended up adding a column for parental suicide in the database because it was so common. And of course, we all know that earlyhood childhood trauma does not mean you're going to commit violence, but this is sort of the groundwork. So that was incredibly common. Moving towards what we call a crisis point. Oftentimes these perpetrators are isolated, they're disconnected, they're hopeless, they are suicidal. Many attempt suicide prior, many plan to die by suicide during. And I think that's a big finding, is that you don't go in and do a mass shooting thinking you're going to get away with it. You go in knowing this is my final act. I'm either going to be killed. Some of them plan to be killed by police officers at their school. You kill yourself, which is the most common. There's been a few cases where the perpetrator actually purposefully kind of went down on their knees and put their hands in the air because they wanted to go to prison and kind of watch the notoriety play out afterwards. But it is a crisis point. People around the individual are usually noticing something's off, not necessarily that they're planning violence, but they're acting differently and people are noticing. The third piece we call social proof, can also be called sort of that contagion effect, but mass shooters study other mass shooters. They more recently spend a lot of time online becoming radicalized, oftentimes in chat rooms. They identify with previous shooters. They go down rabbit holes in spaces where violence is celebrated. That tends to be pretty common. And then finally, opportunity. So you have access to the weapons that you need, the guns. For K-12 school shooters, that is almost always taken from family, unsecured guns taken from family because they're current students of the school. They're not old enough to buy. And then access to the target. Perpetrators target the place that they're angry at. So we see that crisis point. One sister of a perpetrator described it was going from kind of what's wrong with me to whose fault is this, right? What's wrong with them and whose fault is it? School mass shooters tend to blame their school. Workplace mass shooters tend to blame their workplace. Other mass shooters blame racial groups or genders or religious groups. And then you pick a target that represents that grievance with the world. And school shootings are meant to be watched. They're meant to be witnessed. They're meant to be public. They're meant to go viral. We have perpetrators who have checked social media while committing a shooting to make sure they're going viral. They're a way to get that kind of pain and anger they're experiencing out to the world and force us all to watch it. And so in that way, they are these really kind of public displays of violence. So when it comes to crisis, in terms of what does that crisis look like? I define a crisis as a noticeable change in behavior from baseline, right? That's temporary. It's overwhelming your coping mechanism. So you have how you're usually functioning, and then you hit a crisis point and something's different. For school mass shooters, that's suicidality, it's depression, it's agitation, mood swings, abusive behavior. It looks different in everyone. And for school mass shooters, we see in particular a lot of early childhood trauma. Oftentimes that's because more of that information is available. So that's important to note. All of our coding is done with publicly available information. So, court records, law enforcement records, media reporting. For a lot of these cases, there's a lot of public information, like until medical records get reported. But so we know more about sort of the early childhoods of these school mass shooters, but we see marked trauma in about 70% of those cases. They tend to be highly planned. About 70% are studying other perpetrators. 45% leave behind what we call a legacy token. A legacy token is something meant to be found after either you die in the shooting or commit the shooting. Oftentimes it's a quote unquote manifesto, or it's a journal, or it's a video that you make, but something that you are hoping people watch or read afterwards. Amazingly, 94% of school mass shooters, we'll call it leakage, leak their plans ahead of time. That just means they tell somebody they're going to do it. That could be specifically telling other people they're going to do it. It could be sort of, indirectly saying you might not want to come to school tomorrow. The most common way that perpetrators leak their plans is in person to their peers. We've had case studies where 60 students knew that a school mass shooting was planned and happening and didn't report. So leakage is actually really important. It becomes kind of the critical spot to intervene. And I published a study a couple of years ago looking really closely at leakage. And we found that leakage seems to be, rather than kind of this narcissistic, I'm threatening before I do something, it really tends to be like a final cry for help. It is saying, like, screaming to the world that I'm going to do this thing with this maybe hope that you're going to be stopped. And one question I would always ask mass shooters when we interviewed them was, is there anything or anyone that could have stopped you? And every time they said yes. And one school shooter in particular said, like, I think anyone could have potentially stopped me, but there was nobody. And so that leakage point becomes a really critical intervention point. I'm going to sneak past this. This is just essentially like, we know that these shootings are a final act. This was a female school shooter, 1979, the Grover Elementary School shooting, who famously, when asked about why she committed the shooting, said, because I don't like Mondays. And that kind of went the 80s version of viral. But at her parole hearing, when she was asked why she committed the crime, she said, I was trying to commit suicide. And they said, why'd you pick the school across the street? And she said, I knew if I fired on the school, the police would show up and they would shoot and kill me. And every time I had tried suicide in the previous year, I had screwed it up. So what this means for prevention, the fact that school shooters are insiders means that physical security is not going to be sufficient because they are entering in and out of the school and they know the security procedures. The fact that students are in a noticeable crisis means that things like crisis intervention, knowing the signs of a crisis, anonymous reporting systems, which I'll get into all this next, are really critical. Suicide prevention being a really critical component of this. So not punishing necessarily threats of violence or criminally charging threats of violence, but treating them as crisis points and cries for help. And then reporting systems and relationships, because we know other kids know that this stuff is being planned. How do we build those trusting relationships or those anonymous reporting systems to make sure that information is being shared? And so I say all this, my focus as a psychologist is not reaction, right? It's not what to do when a shooting happens. I have no idea about that. And there are many experts in that space. It's really, how do we prevent it? And I will say we spend a lot of time and energy and money and training hours on reaction, right? What do we do when a shooting happens? We train our children, we train our teachers, we do a lot of that sort of worst case scenario planning. We spend maybe less time and energy thinking about how do we prevent it in the first place, and how do we spend that same amount of energy and resources and time and money in thinking about violence prevention. So trying to sort of shift that conversation from only focusing on opportunity on the model to thinking about that trauma, crisis, script, all the pieces that come before it. And we just take this holistic violence prevention approach. So looking at root causes. And the nice thing about these approaches is they really do have a diffusion of benefits. So yes, you are trying to prevent school mass shootings, or you're trying to prevent homicides. A lot of these strategies will also be effective at preventing suicides or self-harm or relationship violence or other form of violence or bullying or depression. These are strategies that hopefully just encourage kind of mental health and well-being for young people. And we conceptualize this rise in mass shootings kind of as a form of this death of despair. We've seen rises in suicides. We've seen rises in alcohol-related disorders, although drugs and things are going down, which is great. But mass shootings, we kind of think of in that space just because they are so much conceptualized to be suicides. And actually, in the last 6 months, we've seen a lot of crimes, very public displays of violence that are suicides in addition to being homicides, whether that's driving a truck and killing 14 people in Vegas, or exploding a Tesla car. I'm sorry, the 14 people was in New Orleans, the car was in Vegas. We've had assassination attempts of President Trump that resulted in suicides and being shot. So there's a lot of this kind of very despair, self-destructive public violence happening. We tried to work with a school district here in Minnesota, so this is the St. Paul School District, to develop kind of a holistic school safety model, right? Like, what would this really look like in our dream world if we could build a holistic school safety system? So this was a 3-year $1 million grant funded by the BJA that we are currently in year 3 of. So we started this grant by going and talking to people. We did focus groups with students. We interviewed lots of teachers and administrators and counselors and mental health workers and security to try to get a look at, like, what is the landscape here? Coming out of COVID, we saw this huge homicide spike during the COVID-19 pandemic. Kids were not in school for 1.5 years here. You're going back, like, what is happening and what are people feeling? The biggest themes we found were just general dysregulation coming out of COVID. I do think that's finally starting to die down, but this was dysregulation amongst students, amongst teachers, amongst administrators, kind of that short fuse, short attention span, right? Kind of forgetting how to do school was a big theme. A spillover of gang and community violence. So where I am was the center of George Floyd was murdered here, and we had huge riots and just an incredible amount of community violence. We saw just sort of pockets of violence popping up where one murder would lead to another, and these real clusters. Some of that spilling into the school space. So kids who were potentially involved with that, or maybe just family members were, or even just having to, like, ride the bus or walk through neighborhoods and feeling that you needed protection. One change that happened here was they got rid of the school buses after the pandemic because they couldn't find any drivers and put everybody on public transportation, and that seemed to really escalate violence within the schools just because of stuff that was happening in community on the way to school. Drug use and drug overdoses were big. A lot of kids with addiction problems as early as middle school. The role of cell phones and social media was a huge thing, bigger than I expected. A lot of people talked about violence as performance and committing violence to be filmed and to be broadcasted is part of almost like an identity forming thing. And so the role of cell phones in the performance of violence and social media for escalating violence, right? We interviewed a 15-year-old who committed murder because of something that somebody wrote on his friend's Facebook page or something, right? It was just so the ability for social media to draw people into conflicts that maybe they wouldn't necessarily be drawn into, to escalate things, seems to be playing a major role. This idea of kind of students roaming hallways, physical security, classroom management being tricky, a lack of quote unquote consequences for students. But when we push people on that, a lot of what they said was there's not intervention for students at a real intense level, that if we have students who are really struggling, we don't want to suspend them. We know that doesn't work. We don't want to expel them. We know that doesn't work, right? We know this stuff doesn't work, but we don't really have another strategy for what to do. And then concerns about how do we do things like threat assessment? How do we say that we're concerned about students, but also worried about things like information sharing, right? And what's protected and what's not, and how do we create those open communications while still keeping student privacy and keeping kids safe? We also analyzed in this school district every incident of bringing a gun to campus or making a direct threat of violence with a weapon. These were incidents where students had, or these are students that had 3 or more incidents. So 3 or more times of bringing a gun to school, which is a very sort of big cry for help if you were bringing a gun to school and being caught that many times. What's interesting is out of a district of 35,000, I believe, students, we're talking about 59 students. This is a very small and somewhat, to me, manageable group if you're going to design an intensive intervention. What you also see here is it's those transition years, right? It's 6th grade and 9th grade was the age of first incident. And this we've seen nationally in doing this work is that students, maybe you have really good relationships in elementary, you've figured out what works for you, you're stabilized, and then you're thrown into a brand new environment where nobody knows you. And then same thing happens in middle school after 3 years. You have finally formed those relationships, people know what works for you, and then you're thrown into a new environment in 9th grade. So that communication kind of across systems becomes really important. That transition, openly communicating between schools, kind of what worked for this student, what might work now, building in things like letting those 6th and 9th graders come to school 3 days before the rest of the school actually seems to be making a difference. It's a study we want to do. But those years seem to be particularly important for violence prevention. Another thing we did with this grant is taught everybody in the district crisis intervention. So this is a really simple protocol I ended up developing a number of years ago on my sabbatical. I went through every crisis intervention training program, the one for police, the one for nurses, the one for social workers, the one for teachers. I went through all of them and tried to really drill down kind of what are the core common features. So this is a very easy, just like manage yourself, right? Like don't take things personally. Don't panic. Don't take anything they're saying at you seriously. It's not about you, right? Managing your environment. So how do you in a school de-escalate spaces, get rid of audiences, reduce distractions, and then nonverbal and verbal de-escalation techniques. So this is, to me, this is just skills that everybody should have, but it's something that takes some training and takes some reminding, kind of how do I do this? And how do I carve out the space in a busy school when I have 30 kids in my class to be able to do this with a student who is in crisis? We also trained everybody in suicide prevention. And this is something, I remember a conversation with a principal at one point who said, I don't want my shop teacher doing suicide prevention. And it's like, well, actually, you definitely want your shop teacher doing suicide prevention, because if that is the teacher that that student feels connected with, if that's the space that they feel more comfortable, that could be the time that they choose to disclose they're feeling this way. You don't need to do long-term therapy. You don't need to, sit with them for hours, but the basic skills of how do you engage in that 10 minutes conversation, and then how do you get that kid connected to where they need to be connected to, but not feeling a panic in those moments and kind of knowing what to say and do. Um, then we ended up building, I'm going to go here, something that we're calling care teams, really similar to threat assessment teams for people familiar with that model. Threat assessment, I think, is a great model. It brings people together. It gets them talking, information sharing, right? Building strategies. It's essentially the same thing. The only thing I don't like about a threat assessment model is the word threat, especially when we're talking about K-12 school kids. This idea that, and it, I think, sometimes can make it so you zero in on the threats and you maybe miss the bigger crisis. So in the school district we were working with, they had a threat assessment team, but it was really being utilized to kind of expel kids out of the district. It wasn't doing maybe what it was intended to do. So we reframed the whole thing and built what we called care teams, which stands for collaborate, assess, review, and evaluate. Teams were built in every single school, elementary, middle, and high school. And then a team was built at the district level, which was essentially when a school felt like it had exhausted all of its own resources and didn't know what else to do, it would sort of kick that case up to the district level care team. And that was usually cases that might involve, more police investigation, long-term hospitalization, we're not any different, more intensive placement, things like that would get sort of moved up. So in building these, it was like, how do we make sure we have the right climate? How do we identify what resources are available? We did a big resource assessment. I think a lot of times it feels like, what are we supposed to do for this kid? And there's actually more resources in the communities that people than maybe the school knew about, but the connections really weren't there. So how do we build those connections, those referral processes, figure out what behavior is reported, created a centralized reporting system. So they were able to create an anonymous reporting system with an app. Some people just have, anonymous Gmail accounts, but what gets reported and by who, and then training everybody. The piece we're working right now is a lot on communication. Like, how do you communicate with your school community ahead of time that when there is violence, here's our approach, right? Because we hear from principals a lot of time, like, I know this is a crisis. I know this is a cry for help. I know I shouldn't be, criminally charging this kid, but I have all these parents and they're really scared and angry, and that's what they want to have happen. So how do you, before an event happens, explain to your community, right, when this happens, this is why, this is what it means, and this is our approach. We're going to pull that kid in instead of push them out, because that's actually what keeps our community safe. And this is just very similar to the general threat assessment model. You have a team leader, you figure out who's doing the interviews, who's most connected to that kid that we're worried about. Law enforcement, of course, if there's immediate risk to self or others, but not stopping at that. So if it's not an immediate risk, that doesn't mean it's done. It means there's more time, because the next time it could be an immediate risk. Fact-finding interviews, gathering records, and then creating an individualized plan of support. And I think one thing we learned from this process is those individualized plans of support, once you really deeply get to know a kid and what's going on with them and sort of what's the cause of their crisis, I saw a plan of support the other day that was the child needed to be met coming off the school bus and walked to make sure that he ate breakfast in the morning. This is a middle schooler. He got disoriented coming off the bus. He would forget to eat breakfast. There was a struggle for food at home. And if he didn't eat breakfast, he was starving throughout the day. And then his behavior would escalate. But if he ate breakfast, he tended to have a much better day. And so that was the intervention plan, to walk him into the room, make sure he eats breakfast. And then if he was getting disoriented or distracted, his intervention was a nap, because he had a lot of trouble, stuff going on at home, and didn't sleep well. And so like a 30-minute nap, right? And so I think sometimes we think, oh my gosh, this has to be like this intensive long-term therapy or treatment. And sometimes it does. Sometimes that is what needed, but sometimes it's like breakfast and a nap can keep a kid regulated. So that's what I mean by individualized plan of support. But to build that, those look different every time. and you have to really get to know the kid, and then also following up to make sure it's working over time. Sandy Hook Promise is an organization that has a national model for this. I will disclose I am on the board of this organization. I love them. They have a national model where if you submit a tip on their app, it goes to a crisis center, which is located in Miami, Florida, and is responded to by a crisis counselor within 1 minute of that tip coming in. And that crisis counselor will figure out, does this need to go to the school? Does this need to go to law enforcement? Is this an emergency? Does this kid just need to talk and chat for a while and make a plan of who to connect with? And so they are, I believe, I want to say they're in 13 or 14 different states. But this type of model is something I would love to see on a national level. And then, of course, I need to also mention safe storage. We know that when kids have guns, they are getting them from adults that are unsecured. And this could be parents, it could be family, it could be friends, but it's just generally unsecured guns. In that national survey we did, we found it's about 50% of people who own guns will say that they store them safely all the time, which would be unloaded and locked. 14% were most of the time, 9% sometimes, 9% rarely, 20% said they never did. We have a paper under review right now that's looking at kind of why people don't safely secure their guns. The biggest predictors of the never secure were either previous experience with violence or previous victimization, or you own the gun for protection, right? So it's this kind of need to feel like I might need this in this moment. And maybe that's real, that you feel like you're actually at a risk, or maybe that's just a perception. But that seems to be kind of the target of intervention if we want to help people realize that they do need to secure safely, which it's like preventing children from committing homicide, it prevents suicide, prevents accidents, domestic violence. We know it's just a promising practice across the board. It tends to have pretty good support across the political spectrum, across gun owners and non-gun owners, but it seems to be sort of targeting that kind of fear piece as really someplace that we could dig in on. Interestingly, things like safe storage laws didn't seem to make a huge impact nationally. And then lastly, this is a completely different topic, but I thought I would just touch on it. So we also built this higher education homicide database, and you can see these are not distributed equally across the country. We've seen an escalation in homicides on college campuses. They are different in the sense that many of them are related to domestic violence, which I hadn't really thought about the fact, but of course, like you live on your college campus, and so that is your home. And so there is going to be more instances of domestic violence. But it's interesting how different they look than K-12 homicides. So kind of an entirely different implications for things like policy and prevention. This is our website where you can find all of that data and lots of different data visualizations and data interaction things, and also where you can get in touch with me if you'd like to. So I will pause there and leave 15 minutes for questions.
Thank you so much for such wonderful and important information. And I think we can all share the anxiety you talked about dropping your own kids off at school. I know a lot of us share those same kinds of fears. Lots of questions already in the chat, and you have a lot of very responsive feedback and questions here. So we'll go ahead and dive right in to see how many we can get to. So the first one is, what is the geographic distribution of mass shooters across the country? Are they sorting out along lines of a particular state or a familial ideology?
So they tend to cluster in the South and in the West. The West is almost primarily driven by California, which is interesting because they tend to have the strictest gun laws in the country, but a just disproportionately high number of mass shootings. And then a lot of South, like Texas, Louisiana, where there are kind of looser gun laws, but generally more gun violence in general in those spaces as well.
What do we know about interrupted mass shootings, either self or others interrupted? And do those who are interrupted and stopped go on to conduct mass shootings anyway?
Great question. So we don't know a ton about them just because they're harder to track. We interviewed 3 or 4 individuals who had planned a mass shooting and changed their mind or been stopped. And then we also interviewed some sort of school counselors and principals and people who had stopped mass shootings. It From what we know, it's a human connection. So like one principal we talked to, there was a kid in a bathroom. He was putting the gun together. He had fired it. He was ready to enter the hallway. The principal ran in there, knew him, knew his name, just started talking to him and was able to kind of snap him out of it enough to put down the gun. There's been other cases. There's been a case where a janitor actually talked the kid down. So it tends to, and the individuals we talked to who were planning on it changed their mind. It was something that gave them a little bit of hope, right? Like they didn't actually want to die. They didn't actually want to go to prison for the rest of their life. It was a human connection to get them through that moment. I don't know of a case where somebody planned or was stopped mid-mass shooting and then they went and did it later. I think it is a crisis is kind of this time limited thing, right? Where if you can get somebody through it, they don't necessarily get right back there. I worked at suicide crisis hotline and we talked about the metaphor of a balloon so full it's ready to pop, and if you let like a little bit of air out, that's all you really need to do. You don't have to completely deflate it. You don't have to figure out why it's so full. You just have to let a little bit of air out, and in those moments that seems to be what gets somebody kind of out of the mindset.
Great. And that does speak to the importance with mental health of that human connection and social piece. Um, Given the data on leakage, does the APA still offer resources for school shooting prevention? For example, in 1999, APA worked with MTV and produced a 21-minute video titled Warning Signs, as well as collateral handouts. Are these or similar materials still available?
I don't know the answer to that question, but I'm writing it down because I'm going to check it out. It would be great if they did.
Great. Someone else says, this is one of the finest lectures I've seen in this series. Their question is, do you have any information on people who met every step in your progression but the last? And then they had a comment that what they love about your approach is that it eliminates the dangers of false positive predictions.
That's nice. Thank you. Yes, and again, it's so hard to study things that didn't happen, right? Like it's just like, how do we gather data on somebody who got all the way to the point? And then what we do know is the thing that you can go all the way along that pathway, right? At trauma, crisis, want to do it, study, be radicalized, be angry, all the way down. If you can't get your hands on a gun, you can't do it, right? And so we do know of cases like that. We also know of cases where a kid tried to get his hands on a gun for a year and a half, and then on his 18th birthday was able to go get the assault rifle and do the shooting that day, right? And so that tends to be, I think, the final thing that if the guns around your house are secured, I will say there's a lot of ways to get guns. There's people ask friends to buy them or cross state lines or do, private sales. And we do know it's hard to truly prevent that. But yes, there are certainly cases where that's kind of the final step.
Okay. Is there any research in school or school-based therapeutic interventions for gun violence? And if so, what does it suggest?
A good question. You know what's interesting? So I just wrote a APA chapter on sort of gun violence from a psychology perspective. So much of the gun violence research comes out of like criminology and sociology and public health and like all this, and it's like targeted gun violence, like intervention programs and their outcomes and how well they work. There's not as much as I kind of thought there would be. Once I really got deep into it, I do think that like general therapeutic practices are violence prevention, right? It's like if you're doing suicide prevention or crisis intervention or you're identifying trauma or any of those things, that is gun violence prevention, even though it's not like, it doesn't specifically be labeled that way. But I do think there's really space for the field to think about that, right? Like, what does this really look like? What does it mean in a school-based environment? So much of it's individualized, right? And figuring out like, why is this child carrying a gun, right? Like, where is this coming from? So much of it, I think, is about giving hope. We just finished a study where we talked to 20 young perpetrators of homicide who committed homicide during the kind of 2020 peak. And most of them were under 18, and they all talked about just a futurelessness, right? Like just the assumption that they would be dead by the time they're 21 or in prison, just kind of a not caring, feeling really empty, those sorts of feelings. I think that is very much targetable through mental health intervention.
Absolutely. This person asked a question that I'm curious about as well. What might explain the acute increase in school violence in 2018 and its persistence? The timing seems to point to legislative changes prior to 2020 rather than pandemic-related dysregulation.
True. And I don't think anyone knows the answer to that exactly. We saw the same thing where the spike in mass shootings happened around 2018. It's hard to know, right? Like, is it national? Was it Trump presidency and a difference in political rhetoric and the public conversations that we were having? Was it a policy shift? It's hard to know exactly what that was. And any person you ask will have a different answer. But I think it is a good point. The shift did happen prior to the pandemic and then just kind of stayed high.
Yes. How often do you recommend training district staff on threat assessment protocols?
Um, I think it depends on the district and sort of your size and what your protocol is. I do think at least yearly to be checking in and training, and also just refreshing those like crisis intervention, suicide prevention skills, all those types of things, right? Like, what are the behaviors that we're looking for? What is concerning mean? And there's the constant kind of follow up and making sure you're evaluating yourself, right? Like, did that work when we did that and we tried that thing? How's that kid doing now 6 months later? Like those types of things. I mean, I always think more training is better, but it certainly depends on kind of the specifics of your school.
Great. This person asks, how do you manage parents' desire for justice and punishment versus the needs of the student slash shooter?
I think that's a really difficult. And when something like this happens, I mean, it's absolutely terrifying. And I will say schools are dealing with threats constantly, daily. I mean, there's been school shooting threat TikTok challenges, right? Like schools, this is something that schools are dealing with constantly. They are not trained for it. They are not resourced for it. It's not their, they're meant to be educators, not investigators of this. And principals will say, I make this call and then I sit up in my bed at night and I pray that it was the right one. And I did, like it's just an unfair burden that we've put on schools. I think we need to think about how do we prevent these threats, right? Like so many of them are jokes or hoaxes, and so schools will take this attitude of like, let's punish really hard and let's charge you with a terroristic threat and throw you in prison for 10 years so nobody else does it. I'm not sure that's the right approach. I think in many ways, our young people are so desensitized to this. They've been running through these drills since they were 3 years old, right? Like they're so desensitized. They don't know a world without it. It's like pulling a fire alarm to them, right? To get out of class. Like I can get out of a test if I do this. So how do we resensitize in some ways, right? And build up that empathy and teach kids what this means? How do we talk to parents about like when this happens, the best thing we can do to keep our school safe and your child safe is like wrap around this kid and pull him in. And there's been some really beautiful examples of that in different communities. The worst thing we can do is shove this kid out. Like you cannot expel or punish your way out of this. There's been so many cases where a kid gets expelled and comes back and does the shooting, right? It's seeing this as a cry for help, seeing this as a suicidal crisis, seeing this as a kid in need of some really critical intervention, but you have to have those conversations with parents outside of a crisis. Like when you're in a crisis mode and this just happened, that is not the time to have these conversations. You have to do it. And it's hard because people don't want to talk about it other than that. So, but
Sure.
you know, like, how do you have these conversations? Like, here's what a care team model is. Here's our approach, blah, blah, blah. So when you say the care team's working on it, that's meaningful to parents. But we do know also, like, quick, open communication, things tend to go awry when communities feel like they're not being communicated with and they're being lied to, or information is being kept from them. So sort of quick, honest communication being really important.
And I love that approach about pulling them in versus further isolating them, because these are kids who I'm sure largely feel isolated as it is.
Right.
And yeah. Um, for those individuals who committed a mass shooting and were willing to participate in your study, did you find a correlation in their psychopathy or mental illness among the group?
Yeah. So obviously the ones that agreed to speak with us were not necessarily a representative sample. I mean, I got a few letters back that were strongly worded about their feelings about psychologists and the fact that they did not want to participate, right? So the ones that chose to participate were a select sample. They tended to be ones that had a bit more space from their shooting, like between 5 and 10 years, probably since. So a lot of them had done work, right? Like a lot of them had done a lot of reflection, had done therapy, had been in groups, like they were ready to talk about their story, I think, in a different way and had a bit more perspective. It wasn't that like super raw being right in it. Um, I would say, you know, it's interesting with psychopathy. There's an element of committing a mass shooting that is very narcissistic, right? It's like, I was owed something by this world and I didn't get it. And I'm mad. And I'm not just going to kill myself. I'm going to kill all these other people too. And you're going to remember my name and my face. And I'm going to be in the history books, right? Like there's that mentality that is kind of this angry and narcissistic piece. There's also like, I don't want to live. And they tend to be pretty hopeless and depressed. It's just not something I generally associate with psychopathy. I didn't do mental health assessments on any of these individuals. I would say I'm sure they all had something, right? Like I'm sure they all talked about anxiety. They talked about depression. We didn't talk to anybody who had a thought disorder. Just in that group. I will say when we looked at psychosis amongst mass shooters, it is overrepresented. So it's about 25% of the perpetrators had some sort of thought disorder. But when we looked at its role in the shooting, it was about 10% of shootings you could say seem to be really attributed to psychotic thinking, beliefs, delusion. So it's not zero, right? It is that 10%, but it's not most. So yeah.
Thank you for that information. Someone said they're interested in the data on the 59 kids bringing a gun to school 3 times in a Minnesota school district and the intervention program that was designed. Is that published and where can we access it?
Is not yet published. So we're in year 3. We will be writing it this spring. So hopefully by like June, we should have that out.
Great. Someone says with the Nashville shooter, the individual used to go to school at that particular school and they knew the building. And it sounds like from what you said, they usually are insiders that know these buildings pretty well. So keeping that in mind, what do you think could have been done differently in that situation? Or is there really anything since they tend to know the system pretty well?
Yeah, I mean, I never like to, armchair quarterback these situations. It's hard to say like, oh, if only this had happened or this had happened or this had happened. Those ones where it's a former student are really tricky. And it's that one, right? Sandy Hook, former student, Uvalde, former student, right? So they were young when they were there. So it's not, the teachers don't have eyes on them now, right? Like now that they're older teenagers. So there's not that prevention piece. And yet they know the school and the security procedures and all about the school. So I think those are actually the hardest ones from a school perspective. What can you do? I mean, that is where physical security and at least making sure you have eyes on every person coming into your building and a conversation with why they're coming in But in those cases, there also was a lot of leakage, right? There was people worried about them. There was tons of warning signs, but it's like in addition to those school systems, we need those community systems. Like, where do parents go when they're worried about their 19-year-old kid, right? Where if someone's posting things on social media, like where does that go? Those sort of national crisis pieces that I don't think we have in place yet.
That makes sense. We are at the top of the hour. Do you have time for one more question, or are
Or
you
I can do one more.
okay? Someone says that clinicians have asked them about any resources for like exposure therapy resources, or they say ideas is the best way to characterize it. Their concerns are that nothing is working and that the level of fascination with handguns in particular among youth is alarming. Do you know of any related resources or research that they can provide when people ask?
Oh, interesting. Not off the top of my head, but I would say like fascination with guns, right? Like fascination with other perpetrators of school shooting. Those would be like, if I had to say my primary concerning warning signs, right? Especially the tends to be Columbine and Parkland. Those are the two that students get really fixated on. And that fixation, I think, is a huge red flag. In terms of what the actual therapeutic intervention should be, I'm not sure we have those resources yet. I think it would be very individualized, but it's a great question. And I think we just need so much more work in that space.
Great. Thank you so much. And just so you know, there are also more questions and several comments in the chat just thanking you so much and talking about how wonderful and helpful this presentation
Oh,
was.
good. Thank you.
So yes, thank you so much. So that wraps up this week's Law and Mental Health series. Next week, Dr. James Fairfax Colombo will join us to discuss the sequential intercept model as a public health model. We hope to see you then for another great discussion of issues of behavioral health and the law. Until next time,
Thank you.
thank you.